Dr. Judy Mikovits has been called one of the most accomplished scientists of her generation. Her 1991 doctoral thesis revolutionized the treatment of HIV/AIDS. At the height of her career, Dr. Mikovits published a blockbuster article in the journal Science. The controversial article sent shockwaves through the scientific community as it revealed that the common use of animal and human fetal tissues were unleashing devastating plagues of chronic diseases. For exposing their deadly secrets, the minions of Big Pharma waged war on Dr. Mikovits, destroying her good name, career, and personal life. Now, as the fate of nations hang in the balance, Dr. Mikovits is naming names of those behind the plague of corruption that places all human life in danger.
So this is where it all began. Hello everyone, I hope you are all doing well today. My name is Beth, or Queen of Spade. Please do give this video a like, subscribe if you're new, and without further ado, let's throw some spade. Today, we are going to be diving into where the conspiracy theories surrounding COVID-19 came from. Judy Mikovits is one of 13 researchers who, in 2009, claimed to have found a link between a mouse retrovirus and chronic fatigue syndrome, a disorder with no proven explanation and no cure. The findings were published in the prestigious peer-reviewed journal Science. The paper was retracted 2 years after its publication. Science said at the time that multiple laboratories, including those of the original authors, have failed to reliably detect the mouse retrovirus in chronic fatigue syndrome patients. The journal also cited evidence of poor quality control in a number of specific experiments in the report. Mikovits has not published anything in scientific literature since 2012, but she has co-authored 2 best-selling books with Kent Heckenlively, a noted anti-vaxxer. After her study was retracted, Whitmore-Peterson Institute at the University of Nevada fired Mikovits in September of 2011 from her job as research director at the facility. In November 2011, a criminal complaint was filed against Mikovits for allegedly stealing computer data, notebooks, and other property from the institute. Mikovits was arrested in California as a fugitive on a warrant issued by the Reno police in relation to the November 2011 complaint. She was held in California jail for 5 days before being released after an arraignment hearing. The criminal charges were later dropped, although the Whitmore-Peterson Institute subsequently won a default judgment in a civil suit against her, seeking the return of the items. A colleague at the Institute admitted in an affidavit for the criminal case that he had taken items from the lab on behalf of Mikovits. Plandemic, the hidden agenda behind COVID-19. A 26-minute documentary-style video that was viewed by millions of people on YouTube, Facebook, and other social media platforms. It is said to be the first part of an upcoming documentary, according to California production company Elevate Films. It consists of an interview between filmmaker Mickey Willis, whose other videos highlight conspiracy theories, and Dr. Judy Mikovits. A typical viewer of Plandemic may not know these details about Mikovits' background. They also may not realize that the information presented in this video is false, fake news. Therefore, when this video was viewed by millions of people, many of them took it as true. It looks good. They sound intelligent. After all, she is a doctor, and without further research into their claims, it could be very easy as a viewer to fall for the misinformation presented. The documentary is about Mikovits' theories that the coronavirus pandemic was planned. In the video, she claims that the virus was created in a laboratory, that wearing masks actually make people sick, and that flu vaccines increase people's odds of contracting COVID-19. She also makes repeated accusations against Dr. Anthony Fauci, one of the lead members of the Trump administration's White House Coronavirus Task Force. One of Mikovits' main claims is that the coronavirus was created and manipulated in laboratories in China and the US. Despite previous reports that US officials were investigating the possibility that the virus was secretly manufactured in a Chinese lab, there is no scientific evidence to support these theories. A study by researchers from several public health organizations published March 17th in the journal Nature Medicine found that the virus, when tested by computer simulations, does not appear to bind well to human cells. The researchers determined that if someone wanted to create a dangerous virus capable of spreading among humans, their own simulations would show that the virus simply wouldn't work. Our analyses clearly show that SARS-CoV-2 is not a laboratory construct or a purposefully manipulated virus, researchers wrote in the article. Scientists who have studied the virus point to bats as the likeliest source of transmission to humans, suggesting that COVID-19 was created by nature, not humans. The earliest reported cases of COVID were linked to a live animal market in Wuhan that sold exotic species, bolstering this research. Mikovits also claims that COVID-19 was derived from the SARS virus. While the novel coronavirus is similar to SARS, both originated from bats, cause respiratory illness, and spread through coughs and sneezes. SARS-CoV-2, the virus that causes COVID-19, is a new disease, according to a study published in The Lancet. What did she do? Take SARS and just decide it came from SARS? According to several independent studies, the virus's genetic structure closely resembles one that already exists in horseshoe bats in China's Hunan province. Sorry if I said that wrong. Bats have an unusually high capacity to harbor viruses, and scientists believe the virus may have spread from bats to an intermediary animal, possibly stray dogs, snakes, or pangolins, before infecting humans. In the video, Mikovits alleges that wearing a face mask can activate the coronavirus. She says that people who wear masks are becoming sick from their own reactivated coronavirus expressions. There is no evidence to support this. According to health professionals, wearing a non-medical face mask may prevent the spread of the coronavirus. It does not make people more susceptible to it. public health officials have recommended that people wear homemade face masks when they're out in public, especially when physical distancing may be difficult, such as in grocery stores or on public transit. This is to protect others around the wearer, because there is evidence the virus can be spread among asymptomatic individuals or those who don't have any symptoms of COVID-19. Hydroxychloroquine, an anti-malarial drug dubbed a game changer by US President Donald Trump for its potential ability to fight the new coronavirus, was found to be no more effective than standard treatment in a small Chinese study. However, in Plandemic, Mikovits repeatedly pushes it as effective against these families of viruses. While some studies have found that hydroxychloroquine could mitigate some symptoms of COVID-19, other research has found no such evidence. Health Canada issued a warning in April of the possible side effects of the drug. In the health advisory, Health Canada said it is concerned people may be purchasing chloroquine and hydroxychloroquine to treat or prevent COVID-19, and that the drugs should not be taken unless prescribed and under supervision by a physician. Health Canada said that the drugs can lead to dizziness, fainting, seizures, liver or kidney problems, and a potentially fatal irregular heart rate. There are more than 50 studies in the works on hydroxychloroquine, including here in Canada, but health officials say it is too soon to know whether the drug is a viable treatment. There is currently no accepted cure or vaccine for COVID-19. In Plandemic, a number of identified individuals described only as doctors are seen questioning the guidelines put out by the Centers for Disease Control and Prevention, the CDC, on physical distancing or suggesting the preventative measures have been issued for profit. Mikovits alleges that doctors and hospitals have been incentivized to count deaths unrelated to COVID-19 as having been caused by the virus to get greater payouts from the American Federal Health Insurance Program, Medicare. Medicare pays hospitals a set amount of money for the treatment of certain diagnoses, regardless of what the treatment actually costs. Medicare has determined that a hospital gets $13,000 US if a COVID-19 patient on Medicare is admitted, and $39,000 US if the patient goes on a ventilator. The CARES Act, one of 3 federal stimulus laws enacted in the US in response to the pandemic, has included an add-on of 20% that Medicare will pay hospitals for COVID-19 patients in a move to help with their lost revenue from the halting of elective surgeries. However, Congress has included strict policies for reporting this. While the US government is giving more money to hospitals that treat coronavirus patients, there is no proof that hospitals are over-identifying patients as having COVID. I mean, why would they want to do that? Seems silly, even for a cash payout. All of this misinformation has made it so that the documentary has now been banned from social media. Before we go into more detail about that, however, I just want to highlight some amazing false or misleading claims made in the video that I wish to go further into that fact checker PolitiFact did an amazing video on. False or misleading claims made in the video proven wrong by PolitiFact. Roll! Mikovits claim in the documentary that notebooks removed from the institute were planted, or that the National Institute of Allergy and Infectious Diseases and its director, Anthony Fauci, bribed investigators. This is in relation to the charges that were laid on Mikovits. When asked, both Mikovits and Willis admitted that it was an error to say she had not been charged, and in fact, she had meant to say that the charges were dropped. Mikovits saying that, "I've been confused for a decade," and that in future she would try to be more clear when she talks about the criminal charge. "I'll try to learn to say it differently." That hospitals receive $13,000 US from Medicare if you call it COVID-19 when a patient dies. This claim, which had previously been promoted by the American Spectator and WorldNet Daily, was rated half true by PolitiFact and Snopes. Payments are made, but the amount is open to dispute, and there is no evidence that this influences diagnosis, and in fact, the evidence suggests that COVID-19 is, if anything, underdiagnosed. This was important to mention, as once again, I have a hard time believing the hospitals are paid out by diagnosis. That hydroxychloroquine is effective against these families of viruses. PolitiFact researched where this misinformation came from. This claim originates with work by Didier Raoult, sorry I don't know how to say that, which has subsequently received a statement of concern from the editors of the journal in which it was published. The first randomized controlled trial to evaluate the efficiency of hydroxychloroquine for the treatment of COVID-19 found no evidence of benefit and some evidence of harm. The NIH says that there is insufficient evidence to recommend for or against this use. Other bodies are currently running additional controlled trials to investigate hydroxychloroquine's safety and efficiency. That flu vaccines increase the chance of contracting COVID-19 by 36%. This claim is false, as we discussed, but again, where did it come from? Mikovits didn't just pull it out of her ass, or did she? No. The claim misinterprets a disputed article that studied the 2017 to 2018 influenza season, predating the COVID-19 pandemic. The claim that the flu vaccine increases the chance of contracting COVID-19 does not appear in the original article at all. The author, Greg G. Wolf, wrote that coronavirus cases increased from 5.8% non-vaccinated to 7.8% vaccinated, with odds ratio of 1.36 with 1.14, 1.63, 95% confidence interval, and the article highlights said, vaccinated personnel did not have significant odds of respiratory illnesses. The article was referring to seasonal coronaviruses, common cold, but COVID-19 was added by the website disabledveterans.org. Also, one last point that needs to be made about the information on masks actually helping to spread the virus or continually give it to yourself. Masks prevent airborne transmission of the virus, especially during the asymptomatic period, which is up to 14 days, when carriers may not even be aware they have the disease, and a virus may be deactivated but cannot add to one's infection level if it leaves the body even temporarily. So that claim is a load of crap and makes no sense. The documentary was convincing to millions of people. Why? The video taps into our collective anxiety during this pandemic of looking for someone to blame, some clear answer to the questions we are asking. Sometimes it can be easier to believe a conspiracy theory than the truth. A conspiracy theory seems more in our control. A virus, not so much. And the video was spread around social media. Thousands of people were sharing it and discussing how their free speech was being infringed upon by the removal of this video. They claimed it was their rights to know the truth about what occurred with the coronavirus outbreak, and they demanded the video not be banned. Although social media giants such as Facebook and YouTube have largely removed this documentary, copies and variations of the video are still up on alternative social media sites where hundreds of thousands of people are watching them, and links to that content keep popping up on the mainstream platforms. The original version has been removed from Facebook and YouTube in their push to crack down on false or misleading information relating to the COVID-19 pandemic. Facebook said some of the documentary's claims could cause imminent harm, and YouTube cited medically unsubstantiated diagnostic advice. Nonetheless, clips and modified versions of the documentary have resurfaced on the sites. Facebook has labeled them false and linked to fact checks by news organizations detailing a range of problems with the content, including its promotion of conspiracy theories and incorrect medical information. Complicating this effort is the fact that Plandemic is easy to find on websites known as alt-tech platforms, many of which position themselves as alternatives to the popular mainstream social media platforms and as proponents of uncensored free speech. Zareen Karazian, Assistant Director at the Atlantic Council's Digital Forensic Research Lab in Washington, D.C., which studies disinformation and how it affects democratic norms, says in the case of Plandemic, the filmmaker seemed to anticipate the video would be downranked or removed from major platforms. Initial posts featuring the video predicted as much. At the same time, she said, copies began to spring up on the alternative video platforms. Then, when the video was flagged and removed from mainstream social media sites, links to the video on alt-tech platforms showed up on Twitter and Facebook. That's how the video is sort of staying alive even as the major platforms, with the control that they have, tried to remove and downgrade it, she said. I think, paradoxically, what has been happening with the Plandemic video is a sort of censorship backfire. It's called the Streisand effect. Matthew Johnson, the Director of Education for Media Smarts, a Canadian nonprofit that promotes digital and media literacy, says in some cases the alt-tech platforms are set up specifically to host content that gets taken down elsewhere. Sometimes these are created by conspiracy groups, hate groups, by health misinformation groups as a refuge, and sometimes it's just that one of these platforms may have a more laissez-faire attitude toward content moderation, said Johnson. So, what do we do about this misinformation and how it seems to be spreading faster than the virus itself? All we can do is downvote and report videos when we see them. These videos are harmful and sharing these conspiracy theories is affecting our world. There is a much larger anti-vax community being formed during COVID, and it is mainly due to this information from the movie Plandemic being spread around. In fact, Plandemic, the movie, along with those in the movie, Judy Mikovits and Mickey Willis, may be the source of a lot of the COVID conspiracy theories. The information presented in this documentary is false. Stop spreading it around. If you see anyone you know doing so, be sure to link them to this video. Tell them that it is misinformation. Help us end the spread of COVID and the misinformation that surrounds it. In my opinion, Judy Mikovits and Mickey Willis need to face prosecution for the spread of this misinformation, especially if it continues to promote anti-vax and conspiracy theories related to COVID. We don't have time for that. Be sure to give this video a like, subscribe if you're new here, stay safe, wear your mask, and then the only virus you will get will be this misinformation, possibly shared by your friends on social media. Have a fabulous, fabulous day. Take care. Bye.